It's now my pleasure to introduce you to our speakers. Jeff Neiman serves as MediWIT's CEO and leads a top-notch team of healthcare revenue cycle professionals to maximize performance and accelerate growth for hospitals, health systems, and provider groups. Prior to joining the MediWIT team, he was the Chief Operating Officer for Navigant Symmetrics, a revenue cycle management company serving over 200 hospitals. He has also held leadership positions at Conifer Health Solutions, Humana, and HCA, the Hospital Corporation of America, and has a BA in economics from Bellarmine University in Louisville, Kentucky, where he graduated magna cum laude. Jason Petrasic is MediWIT's Vice President of Artificial Intelligence. He drives revenue cycle solutions powered by AI that support healthcare providers' operational, clinical, and financial health. Mr. Petrasic brings over 25 years of RCM experience in revenue cycle process design, efficiency, and resource optimization. Prior to joining MediWIT, he served as National Vice President of Revenue Cycle for Prospect Medical Holdings, Inc., Vice President of Operations for Navigant Symmetrics, and Senior Director of Operations Planning for Conifer Health Solutions. He earned his Master's of Business Administration from Pepperdine University. And with that, I'll turn things over to Jeff and Jason.
Thanks, Leanne, and thanks everyone for joining us today. Just a couple of quick slides on who is MediWIT if you're not familiar with the organization, and then I will turn the bulk of this presentation over to Jason, our head of artificial intelligence, for a little bit of sharing on the real reason everybody joined today. So MediWIT is one of the largest revenue cycle service providers in the country. As you can see from the map here, the orange coded states are just where we have existing offices today. The pins are kind of representative of our customer base, but we're in 47 states across the country from a customer base. Jason, next slide. A few stats here just on who we serve. We've got about 850 hospital customers today, 60,000 total physicians. Employee-wise, we're at a little over 1,600 employees. We're 100% dedicated to revenue cycle management. We managed about $56 billion in accounts receivable last year, so that just gives you a sense of the size and scale of the organization. And as a company, we're very focused on partnering with health systems to deliver an overall better revenue cycle, whether that's outsourcing processes or engaging technology that we have. There's a variety of different ways that we engage with our partners. We're obviously here to discuss artificial intelligence today, but in the course of that engagement, we're very focused on great service relationships and being a true partner where we're representing you in the marketplace in many cases, and your patients wouldn't know if they're dealing directly with the hospital or with MediWIT because we're all a combined service delivery entity partnering together. All right, so one of the things we're using just as a launching point to kick off the conversation today is the post-COVID landscape. A lot of change has taken place over the last year. I think if we had tried to predict back at the start of 2020 where we would be today, nobody would have been able to accurately predict kind of where we've ended up and what's going on. But the consistent theme I'm hearing from talking to heads of revenue cycle and CFOs out in the industry is that volumes have been pretty significant and continue to be kind of at the level that they were before, but they've changed significantly, meaning simply most organizations have pivoted from their traditional set of services and volumes to heavy COVID-based volumes and standing up vaccination clinics overnight, standing up treatment clinics overnight, shifting floors from one type of service to another. A lot of changes in the clinical delivery model. How that's then translated into the revenue cycle is a bit different, but two trends that we're seeing and questions that people are asking consistently nationwide around where to go next with the revenue cycles in the world today, there's really three things. The first two are on here, and the third one is what we're here to really talk about today. But remote work is a challenge for everybody, and it's interesting. As we've done, probably a dozen webinars, many times we've asked questions about how much remote work people are doing, and we see everything across the spectrum. We're somewhat shocked by that, but we see health systems that have gone 100% remote and have no intention of coming back to on-site mortar and brick type operations, to organizations that never went work from home at all, and have been completely mortar and brick, and everything in between. But most people, I would probably say 80% plus of organizations are thinking about and trying to figure out how to work more effectively in a remote work environment, how to engage technology that's better at managing, productivity of their employees, ensuring compliance, those kind of things. And I certainly do think there's an AI play in here when we talk about it as well. And you'll see Jason talk about some of that. Partnering AI up with just how people are working from home can make a huge difference in your ability to manage folks and productivity, and even in the types of employees you need to engage to be successful, as more of the simple repetitive work can very easily be automated in today's world. The second trend that we're seeing is a huge focus on outsourcing. And you hear this probably more from a CFO level than anywhere else, but having scalable organizations is one of the big lessons learned from COVID. So there were a lot of, I'm going to call them roller coaster rides that we're hearing about from a revenue perspective. I mean, overall, I think revenue is down across the industry. I think the AHA in particular had estimated like a $350 billion drop in revenue in calendar year 2020. Spread across, health systems, right? Hospitals and physician practices nationwide. So obviously a huge overall reduction in revenue. But even as the waves of COVID have hit, there have been a lot of ups and downs, right? So we're shutting down all of our elective procedures to 3 months later now, we're re-engaging elective procedures in a very cautious, safe environment. All the way back to in the fourth quarter, some organizations again shutting down elective procedures. So just a roller coaster of revenue. And as a result of that, we're hearing a lot of CFOs that are looking for ways that they can more rapidly scale up and down their revenue cycle operations. And many of them are looking at outsourcing, contingency type contracts, things of that nature, at-risk type of arrangements where the vendor's really out on the branch with the health system or the organization, trying to figure out how to share risk as volumes may be fluctuating in oftentimes unpredictable manners. And then the last one we'll tee up here is, again, the point of the conversation today, which is artificial intelligence. We're definitely seeing a huge interest across the industry in AI. It's kind of the buzzword, right? It opens a lot of conversations right now. I think you got to be cautious, and Jason will probably talk about this a bit today toward the end of the presentation, of what's really AI and what's not, and what's valuable. And candidly, at the end of the day, my perspective on this is there's almost everything's being called AI today. And I kind of giggle when I look at it, because probably 70% of it's not really AI. That said, I think as customers, do we even care? I think what we're looking for is efficiency gains and automation, and whether it's AI or something simpler like predictive analytics or robotic process automation and things, maybe it doesn't matter, because what we're kind of calling AI is if something can do what a human used to do and replace the human, that's kind of what the marketplace is calling AI, even though it may not actually be true artificial intelligence. But we'll get into some of that in the conversation today. I'll just leave us with saying, MediWood as a company decided to make an investment in artificial intelligence about 18 months ago. We really took probably the first 6 months to plan and onboard people and things. So we've really been a little under what I would call 12 months into our true development journey. And the thing that's really amazed me, and Jason will share this today, is we've gone from automating our first process probably back in August of 2020 to really today about 9, 10 months later here, being at a point where we've gone from one process to almost 20 processes that are capable of being automated. So the shock point for me was, I thought we wouldn't get to the point that we're at today for probably 18 to 24 months. And the learning and the speed of learning of true AI systems is so amazing that the acceleration of just how quickly it's learning is kind of exponential growth in the number of things you can begin to automate. And we're getting to the point where almost everything can be automated. There are certainly claims today that can be worked from bill drop all the way through full adjudication of the claim with absolutely zero human intervention. And I'm not just talking about because the payer auto adjudicated the claim, but even things like, filing technical appeals and those kind of things. So Jason will get more into what we're seeing as AI's capabilities in the marketplace today and the scope of those capabilities. But it's pretty compelling, pretty interesting. And I would say, if you're not thinking about this and you're not getting ready to jump on the board, the train's going to pass you by. So without further ado, I'll tee up Jason here, who is our brain trust on artificial intelligence, to talk about what he's seeing the capabilities of AI in the industry today already and where it's going next.
All right. Thanks, Jeff. And thanks everybody for attending today. So just a quick, overview of what I'm going to highlight over the next 45 minutes or so, and that is, a little bit more into the details of how AI is changing revenue cycle and how we're, as organizations, healthcare organizations, are maximizing the benefit. And then also want to talk a little bit about, the impact on the people, which is really important. And then I want to leave you with some hints that we suggest to look at when you're evaluating a partner for this journey. All right, so first thing we're going to dive into, and Jeff mentioned this, is what is artificial intelligence, and there is a bit of a buzzword around it, but it's that next level of automation. It's that next generation of automation, and that can apply, pretty much anywhere in the revenue cycle. As Jeff mentioned, we're seeing things that are in place before the patient ever arrives at the hospital, right? A lot of organizations have spent a significant effort standing up a financial clearance team. Well, a lot of that is repetitive, work, going online, checking the benefits, making sure the scheduled service matches with the benefits for that plan, and calling out any issues, things like that. So there's a lot of volume of manual, repetitive work to go out and do some analysis. So that's an area, all the way at the front. In the mid-rev cycle, we're seeing some autonomous coding, all the way to the back end, where we're looking at those technical denials and what can we do to overturn a technical denial and get a claim paid that's never been paid. So we'll talk about some more examples in a few minutes, but I want to circle back to Jeff's comment about what is AI, right? So again, as rev cycle leaders, we don't need true science fiction artificial intelligence, but there are several categories of tech that I would say fall under this banner of AI, and they're all valuable. And so we'll talk a little bit about each of these. Regression analytics is looking at patterns in your data and predicting what's going to happen. And for many years, we've used propensity to pay scoring for self-pay, whether you insource or outsource your self-pay. Whoever's doing that is almost guaranteed to be scoring those patients and looking at which ones are likely to pay. A lot of our organizations have moved into presumptive charity, using some regression analytics and some external data sources. And then one of the interesting areas that are now opening up is looking at payer behavior and understanding both from a timing perspective of when is my payer going to respond to this claim, so that you can adjust your work efforts in your business office, all the way to looking at a recoverability score, right? So if you've gotten a denial on a claim, what's the probability that you're going to get it paid? And can you order the work in your business office so that you have your highest value or your most likely to be paid denials worked first? And if you run out of time, run out of resources, the ones they're not getting to are the ones that are least likely to be paid. So a lot of really interesting use for that regression analytics. The big area where we see a lot of activity is robotic process automation. And 20 years ago, we had scripting that it was uploading, keying adjustments into our mainframe patient accounting systems. But the technologies that are available today are, significant advance over that. They can interact with multiple applications. Epic is one of the more complex patient accounting systems in terms of the screens and the navigation. And RPA is working great within Epic and doing some of those repetitive tasks that people are stuck working out of work queues in most cases. So whether it's Epic and Cerner and kind of a next gen, or if you're on a Meditech or anything older than that, it also handles that. But what's really fascinating is that the robotic process automation tools can move from application to application on your desktop. So if you've got something that you're doing, your business office uses Excel for, you can read an Excel file. If you've got payer websites that you need to access, you can access that. You need to do functions and upload, and you need to copy from one and paste into the other. It can handle all of that. So there's some great tech available as the platform for all of the automation in RevCycle. And Jeff mentioned the speed of growth, the speed of learning, and that really falls under the banner of supervised machine learning. And this is kind of the closest we get within what's being marketed as AI to true AI, and that is using our RevCycle experts to teach business rules to automation. Like, when I see this, what do I do? Okay, well, grab that, capture a business rule automatically based on that, move on to the next one. And if I see that again in the future, then I can repeat that business rule and say, oh, I saw this before. You told me I'm supposed to do this function, and that's what I'll go and do. So that's how supervised machine learning works, which is kind of teaching the toddler to grow up, like teaching them language and teaching them how to interact with other kids. And it's really fascinating to kind of see this tech evolve. Now I've got on the slide here unsupervised machine learning, and this is like the science fiction version of AI that people think about, right? Where you just like plug in a black box and it just does everything, and you don't know what it does. But so I don't think this is really ever going to apply to RevCycle, and this is okay. But the reason for that is because we're a highly regulated industry. There's a ton of compliance rules that we have to deal with, whether we're talking about Medicare rules, Medicaid, state rules, HIPAA, all those kind of things. And so if you imagine a unsupervised artificial intelligence that was trying to fix your rev cycle, it could go in, it could start looking at denials, and it could say, oh, if I change the CPT code on this claim, it'll get paid. Like, well, great. I mean, AI figured out how to fix that problem, but that's not allowed, right? You can't just change a code in order to get reimbursement, because that's not compliant. So that's why I really think the science fiction version of AI isn't relevant to RevCycle. But the other three things are hugely valuable, and I'm going to go through and talk in some more detail about some examples of those where I think we're seeing stuff in effect today. So not like futuristic vaporware, right? It's actually up and running. So I want to give you some of those concrete examples. But those first three bullets are really kind of the critical things that I think of under the AI marketing banner. And the last thing I've got on the slide here is just a comment that you got to have trust and transparency for any automation you bring in, no matter what you call it, right? If you are going to have some tech come in and do some actions, you've got to have a good audit trail. You got to have a good QA process. You got to be comfortable that it's doing the right thing. The last thing you want is to turn on some automation and walk away, and then 6 months later come and find out it's messed up a bunch of claims that you have to manually rework, whatever that process is. So trust and transparency is important. No black boxes, not good for the industry. All right, and just to kind of recap a little bit of what Jeff mentioned, why this is important. We've struggled as RevCycle leaders with staffing and productivity and volume of work for many, many years. Obviously the industry trends are, costs continue to grow. CFOs and finance teams are always looking for how do we do stuff more cost effectively, hold a budget or reduce a budget. And these AI techs, that I mentioned, I think are really kind of the key for success for everybody in the industry, and that's why I'm so passionate about it, and we're so excited about these. All right, so let's talk about what can AI do? What can these automations do for you today? Like I mentioned, we can go all the way from the beginning to the end of the process on the clean stuff, right? So AI is not at the point where it can have a phone conversation with the patient or have a phone conversation with the payer. But a lot of what we do every day is technical, right? It's pushing paper around, it's fixing codes, it's resubmitting claims, it's checking information on payer websites, it's uploading documents to payer websites. All that kind of stuff is not dependent on the ability to have a phone call, and so there's a tremendous amount of work that can be done with automation. All right, so first example is uploading medical records to the portal. So we've seen a big trend in the last 12 months or so in rev cycle for the health systems that we work with, of payers asking for more and more clinical documentations. And you could be a little bit cynical on the provider side and say that that's they're playing the game of trying to slow down the reimbursement and hoping that some of the providers won't submit the records and that they'll never have to pay that claim. But regardless, it's part of the process, right? So they've got the right to request records on claims, and we have to respond as healthcare providers. And a lot of that is very routine, right? So I'm not talking about the complex patient that's been in the hospital for 2 months and has 600 pages of medical records. I'm talking about they had a ED visit and they want an ER report or radiology report or an op report. The more routine stuff that you see over and over again. That's the bulk of the volume, and it takes time. You get the request. Hopefully, you've got a good workflow system that you see that electronic request come from the payer. They say, "Hey, I need records for this claim," but still, it goes into a work queue, and you have to prioritize resources to get to it. They've got to go into the EHR. They got to find the records and print the PDF, and maybe we're faxing it to the payer, or hopefully the payers got more payers have portals now where you can actually upload those records. But that takes time. It might take 10 minutes of somebody's time to go on a $250 radiology outpatient claim to go find that record, log into the payer portal, track down the claim, find the function to upload the record, and do all that. And so it's just very, very time consuming. And so this is one of those things where the AI tech that's out there is already doing this. It's grabbing those basic records requests and responding to them electronically, and then documenting everything, right? So like I said, trust and transparency. If you've got some automation that's pulling records out of Epic, you want a note in the patient record in Epic or in the guarantor record in Epic that you responded to this request, and here's what was done. Because if somebody is following up on a claim 30 days later after an AI automation worked it, you want it to be really clear. What did it do? What did we see? What was documented? And what action was taken? So, again, bringing back all that information very clearly into your patient accounting system, whatever platform you're on, is really important. All right, so another example is financial clearance. So a lot of the platforms, patient accounting platforms today, have real-time eligibility. Great, run your transactions. 90% of your patients come through. You get an electronic transaction. But one of the things that's always been, two things that have always been a challenge is digging down into the benefits. So if you've got a scheduled service, is that service really covered? Yes, the patient's eligible, but that service might not be covered, or it might have some extra rules about coverage or reimbursement for that service. So that's always required a lot of manual effort to go through and verify that, beyond just are they eligible or not, is the service covered. And then the other aspect, and we see this, and this has been a challenge for many years, is selecting the right managed government plan code in your patient accounting system. Patient walks in the door. Oh, I've got Medicare. Great. They get registered as Medicare. Oh, but no, they have Humana Gold Medicare, or United Healthcare, AARP Medicare, whatever, complete. And so taking that eligibility information, which comes back electronically like 90% of the time, and actually parsing through that and saying, oh, this particular patient has this plan code. I see in the patient accounting system it got registered as Medicare. I need to go and update that coverage to Humana Gold or whatever your managed Medicare payer is. Same thing with the states that are dealing with managed Medicaid, which is even much more complex because it's a lot more fragmented in some of the states where not only do you have a managed Medicaid payer, but you have states like California or other states where you've got medical groups. So it's like they're assigned the payer and they have a medical group, right? So are you billing the claim to the medical group or to the health plan? And there's a division of financial responsibility matrix that says where does this claim supposed to go, and all that comes back to what plan code do you register the patient with. And so using AI and robotics, you can go through or parse through that. And again, one of the nice things about automation is that it doesn't care if you ask it to do the same thing over and over again. It doesn't get bored. It doesn't get burned out like some employees would. It's a pretty dreary task to go and check hundreds of eligibilities every day and make updates. But if you use an automation tool for that and get that set up, then you don't have to worry about those employees getting burned out in that function. Okay, so another example is claims editing. And I'm not talking about anything that's clinical, that's really under the purview of HIM or your whatever division of your health system is responsible for actual coding. I'm talking about like the technical stuff on the claims. The example that I've seen is a large physician practice that pivoted to telemedicine last year with COVID. Great, it's great, fantastic. It's exactly what the patients needed. But those claims had to be edited. You had to add special modifiers depending on the payer, change the point of service, and so they were literally touching every single claim that was telemedicine in order to get it to go through correctly. And it's all just technical stuff, right? So you're not changing the coding on the claim; you're just changing the technical aspects. But it was very time intensive. So every claim needed to be touched, every claim needed to be fixed, and so we've seen an AI automation that can go in and do that editing. One of the best attributes of an automation tool that you apply to any part of your rev cycle is the ability to differentiate kind of basic work and complex work. So if, in the example of the claims editing, if it's a straightforward claim and there's, certain CPTs on that claim and or certain procedures that fall within a defined range that you are comfortable with automating, it'll go through and do that. But if it sees one that's had complex, like they had a surgery in the physician office or something just really out of the ordinary, it can skip that and leave that in the queue for your employees. And so at the end I'll talk a little bit about employee impact, but the idea here is refocusing and optimizing the value you're getting out of the employees. If your employees are doing busy work, you're not really paying for the value of that employee's knowledge and skills in the industry. If they're fixing problems, absolutely, that's exactly what they should be doing all day. Whether you're talking about coding billing complex claims or doing complex denial and account resolution, things like that. So again, the idea here is these tools just help you optimize your workforce so that you can take the busy work away and let automation do that and leave the complex critical thinking work for your employees. Another example is adjustments. This is something that plagues a lot of health systems of just trying to keep your AR clean. It got paid, the adjustment, the contractual just didn't get applied correctly. Particular example is a contracted secondary coverage. So Epic, Cerner, most systems don't have the ability to auto adjust correctly when that secondary payer comes in and says primary paid more than I'll allow, and so there's no additional payment, but there's some amount of contractual that needs to be applied. And so using an automation that can go through and scrub those and say, okay, got the remit from the secondary payer, there's no denial, there's no outlier or anything weird with this. They just processed it and didn't make a payment. Calculate that amount, post it to the right bucket in the patient accounting system, NRP the account, or if I guess in that case you're zeroing out the account, but you're moving it on. And most of our health systems, we see hundreds or thousands of patients that have secondary Medicaid or managed Medicaid secondary, that we see this a lot. So again, this is an example of something that doesn't require a lot of critical thinking expertise for your business office staff, but it consumes a ton of time. And that's, again, the idea, these are the things that you look at. Where can I carve off the busy work in my business office and let automation take over and work on these things? All right, so let's talk about some more complex examples here. And this is, looking at something like a timely filing denial. So it's a technical denial. There's no clinical evaluation, required. There's just a technicality. And, when you look through your data and you see timely filing denials, a fair portion of the time it was billed timely and they didn't link up the claim. Maybe the new claim didn't go out with a replacement claim indicator, whatever. Maybe the payer just didn't link it up. But they're fixable, right? You can actually say, here was the original claim. It was filed within time limits. I need you to reprocess this denial. And so, depending on the payer, they might take a reconsideration form that you have to fill out in a PDF and fax it to them, along with a proof of that original claim being within the time limit. They might have a portal where you can go in and kind of initiate a claim reconsideration and attach some documents in the payer's portal. So again, whatever that process is for that payer, it's just a technical automation. It's like, was there a claim filed? Yes. Okay, here's the proof. Upload it to the payer, move on to the next one. Timely filing denial, was there original claim? No. Oh, maybe the charge didn't get keyed for 6 months for whatever reason. Okay, it's a legit write-off. It never got billed within the time limit. Process the adjustment, move on. Again, so these these kinds of technical denials don't require a lot of subject matter expertise, critical thinking, and so they really help the business office kind of refocus that effort. So and again, if you've got a technical denial that you can send a reconsideration form for, or an appeal letter, or whatever your payer wants that format to solve that problem, and initiate that, whether that's by faxing or by uploading, or navigating their portal. The RPA and AI technologies that are out there today can absolutely do this. So I mentioned timely filing as an example. Another example would be no auth denials. So you can use a robotic automation to go through, search related accounts, search a hospital account if you're talking about a physician account, or vice versa. Try to find it, an auth number that was in the notes, and if the claim was actually billed incorrectly without the right auth number, update the claim, change the auth number, resubmit it, and get that processed. Or if it's legitimately no auth, whatever your business office rules are, whether you're going to adjust that off as a no auth denial, or you're going to send it back to patient access to somebody to try to get a retro auth, whatever that process is, the automation can do that. And so, no auth is an example. Eligibility denials, right? So, I talked about using automation to check and verify benefits before service, but you can also use it after service. Unfortunately, at that point, you're dealing with a denial and trying to resolve your AR. But again, it's a technical process. Is there eligibility? Yes. No. What's my pathway? If there's eligibility, was the service covered? Yes or no? And kind of work through that logic and say, okay, well, we got an eligibility denial because somebody in registration keyed the ID number wrong. Okay, that's an easy one. Fix the ID number, resubmit that claim, you're good to go. Or more complex would be they billed the wrong payer. So the example I gave of Medicare versus managed Medicare, right? We billed the wrong payer. It should have been a different payer. Okay, update coverage. What is the process to go through and do that within the patient accounting system? And again, it doesn't require a lot of critical thinking. It's just a very step-by-step process that the AI tech can learn and absorb and say, okay, when I see this scenario, this is the action that I take in order to fix it and move on to the next one. Coding denials. Typically, most organizations will send a coding denial back to HIM or whatever department reviews those. And if that's a work queue in your system, if you're on Epic or Cerner, where you can actually electronically send that to them to do, great. But again, it's still a kind of a step-by-step approach. Parse out what is the reason for the denial from the payer, put that in the request to HIM to say, please review the modifier on this CPT code, or please pay the payer says the diagnosis and the procedure are incompatible. Whatever that issue is that you're sending back to that coder to review, again, that's a step in the rev cycle process that's time consuming, but you're just kind of pushing the paper around, right? You're taking that denial from the payer and pushing it over to coding. And maybe, if you've got certain rules in your organization on certain dollar thresholds of coding denials get adjusted, or certain types of denials from certain payers, it doesn't matter, right? So the beauty of the AI automations are that they'll just learn your existing business processes. You want something written off, it'll write it off. You want something sent to coding, it'll send it to coding. And you don't have to necessarily worry about a process coming in and changing the way you run your rev cycle. All this is just trying to take what is already happening today in whatever aspect of that rev cycle from front to back, and moving that forward. All right, so those are some examples, and all of those are in production today at various clients that you can actually go out and get references on and say, show me how this works, assuming you can get a BAA to cover actually seeing the screens, but you can get some verbal references at least to say, is this working for you? What value is it adding? So this is not futuristic. It'd be great if one day it could. This is all, it's happening today. Let me see it because I need it in my organization. So hopefully some of those pain points in the rev cycle resonated with you, and help you in your journey to look at automation vendors. So obviously, just to, in summary on why it's getting more work done than ever before, right? It's dealing with the volume. Jeff mentioned CFOs looking for being the ability to insulate from business changes, right, and be stable. Create a process that if it scales up because volume picked up, then automation can pick up that volume. Or if it scales down, you don't have to worry about reducing staffing because automation just does a fewer accounts, right? So really creating the ability to absorb those ebbs and flows in work, and then like I mentioned, taking your seasoned expert rev cycles employees and elevating them to the next level of effort in the organization. And so that kind of leads me to what's the impact on people, and I know people get threatened when you talk about robotics and AI and like, oh, I'm going to lose my job. That's not really the intent, and it's not really ever going to happen. It's not like you're going to flip a switch with a vendor and then all your employees go away. That's not the reality. The reality is you're going to have to work the exceptions, and you got to have the experts that can teach the AI what's the right way you want that work done, right? So you're going to have to invest in those employees. The RPA industry has a term for this. They call it upskilling, right? So you take your employees who used to do a bunch of basic tasks and maybe a few complex tasks, and you're going to elevate them, and they're going to do all the complex tasks all day long, and all the basic tasks are going to be off their plate, and they don't have to worry about that. So you're really elevating what you're asking for from those employees. But it's also good because it's more engaging to an employee to use their brain and use their skills and solve problems, and they feel good about resolving this complex claim that took a lot of effort to get resolved. That's great. That's exactly what you want those employees to be happy about. They don't like the busy work, right? Doing 200 adjustments a day, that's going to burn somebody out. That is not a challenging job, right? So when you think about the impact on the workforce, the important thing here is to talk to people if you're going to go on this journey of bringing in some automation and say, look, this is about taking your skill set and applying that to us as a company and as a health system to get more value out of you. We absolutely need you as an expert in this process. So no threat to your job. Now, in reality, over time, if you're a finance person, you may have to you may be able to attrition off some staff, maybe not have to backfill some positions if people leave, right? But so at the end of the day, maybe you have a little bit more efficient cost basis for your rev cycle. But this is not about coming in and laying off 50% of the workforce. That is not the value you're going to get from this. You're going to get the AR cash acceleration value, right? So if you've got 10,000 claims that are sitting in a queue that need to be worked, and you use some AI automation to work those, you're going to get some cash in for that, right? You're going to resolve those issues, get those payments in, and the AR is going to go down, so your AR days go down, cash, ticks up, right? So you have some other, intrinsic values of using tech like this to streamline and improve your rev cycle. It's not all about cost reduction. And so the last comment I want to make is kind of an interesting one that we've seen about the idea of upskilling your workforce, is that productivity is going to go down. And so if you think about it, if somebody was spending half their day doing adjustments, and an adjustment took 2 minutes and they knocked them out, and then the other half of the day they spent doing appeals, and it took 15 or 20 minutes an account. Now, if the only thing they have to do is appeals, their whole day is going to be 15 to 20, minutes per account. So their productivity is going to go down. So if you go on this journey of bringing in automation, think about the aggregate productivity, right? So my automation bots are kicking off, X number of accounts every day, doing adjustments, doing, eligibilities, doing technical appeals, whatever we bring in and have them do. So you have to add those together. You have to take your staff productivity, which will go down because you're taking the easy work off their plate, plus the automation productivity. And you're going to get a pretty material lift in that. And we're seeing, I think we're still kind of young in the deployment of processes, but we're seeing like a 20 to 40% boost in productivity for an organization. And so what does that mean? That means if you've got 10 people in your business office, it's like having 14 people, right? So you're getting so much more work done that it's adding that value. So keep in mind that actual employee productivity will go down. It's not a bad thing. It's actually a good thing. All right. So, the last, area I want to, share with you is just some thoughts on picking a partner on this journey, right? So, some key things here. Are you talking to a rev cycle company that's doing this automation for you? There are some, brilliant AI data scientist type people out. They're trying to break into healthcare and bring their businesses into an industry that desperately needs the help, but they don't know rev cycle, right? They haven't lived it and breathed it for 20 years and understand the tricks that the payers use, and what all the nuances of contracts and provider rules and things that go back and forth between the provider and the payer. And so if you're talking to somebody who's not a rev cycle expert, what we've seen is that you're going to have to spend months teaching them rev cycle, right? So they're going to say, well, we're going to set up a conference room and we're going to whiteboard out, what do I do when I get an eligibility denial? Like, you don't need that, right? You already know as a business office, what do? You go through, check the eligibility, check benefits, correct the claim, move on to the next one, right? So it's not, for us who've lived and breathed it, it's not terribly complex. But for somebody who's never seen rev cycle before, there's a huge learning curve. So that's my first point is make sure that you're talking to somebody who's got some rev cycle experience. And then on a related point, I would say, do they have other services, supplemental services that they offer? And the reason I call this out is because if you're talking about automating a process in financial clearance, and you're going through the automation and you actually see some like business questions or opportunities, like what really should I be doing here? And this is like on in your actual organization. If the vendor you're working with has other resources that they can reach out to, they might have somebody who's worked 20 years in patient access that they could tap on the shoulder and say, hey, can you take a look at this process for us and give us a suggestion? And that helps accelerate your process improvement and your deployment of tech. So again, this is that second bullet. It's really more about the depth of resources beyond just the automation, right? Do they have other rev cycle experts they can call in, and you get the value of that in improving in your processes and your organization. The third comment I have is about customization. And I mentioned this a few times about learning your processes and learning what your payers do. Everybody's different. We've got many clients that are on Epic, and no two versions of Epic look the same. Yes, they have the same screens, and a bunch of people just went through the May 2021 Epic upgrade, right? So all your screens changed, but the workflows and your work queues and how you actually interact within Epic and what you expect your employees to do is all built from the ground up. Every organization builds their own workflow through design and optimization over time. So Epic, same is true on Cerner. They're really not that consistent. And so when you look at automation, what you want is something that will easily adapt to your processes. You've got a special requirement for payer, great, should be able to handle that, no problem. You want to, you have a business PNP for your, certain, rule in your office, adjust off all denials under $100, whatever that business rule is. You want it to be able to be flexible enough to come in and say, oh, okay, this is the rule. I'm going to grab it and apply that and move that forward. What you don't want is somebody to come in and say, we've built a fully automated rev cycle and we're just going to deploy it and we're going to work it all our way, because that's never going to work, right? So Jeff and I have been in the industry long enough on both sides of the vendor and the provider side that every organization is different. They need the ability to have tech that works the way they want it to. So make sure that you're asking the question about the flexibility and the customization ability of whatever you're looking at automating. And then the last point I will make on this is you got to have references. So like I said, there's companies that are trying to break into rev cycle, and it's awesome, super smart people. But you don't have time as a rev cycle leader to be their alpha partner and spend 12 months teaching them rev cycle so they can build a product and take it to the market, right? You have work queues that need to be worked today, right? You have stuff that needs to be done. You have claims that need to be billed. You have denials that need to be worked. All that stuff is there. So, look for vendors that have actual live experience. They're actually working automation for other clients, there are other hospitals or health systems, and they can give you the names of those people, and you can talk to them and they can say, yep, absolutely, we brought them in and they were able to automate this, and this is a huge value to the organization. So you got to see that real actual deliverable. It can't just be that vaporware. Like it'll be great one day if all of this is automated. You got to see somebody who's automated it all today in order to make sure that you're going to get that ROI back quickly, right? So that you solve your problems, bring in your cash, whatever your organization needs. That's kind of where you need to go with that. All right, so those are kind of the guiding principles, I would say, to evaluating a business partner for your AI tech. Hopefully these are valuable to you. And so just to kind of, bring this to conclusion, and we'll open it up for some questions. Absolutely, we think AI automation is going to transform rev cycle completely. The ability to easily adapt to changes and learn your processes, and even as payers change their rules every month, capture those new rules and build that right back into the process. So it's really going to be an amazingly different industry, probably in 5 to 10 years, where almost all of this is automated. So again, focus on the busy work. How do I get the busy work out of my rev cycle? Look at the things that are purely electronic focused. So I've got interactions with payer websites, or my own patient accounting system, or whatever bolt-on system that you've got. Those are the ideal targets for automation, and there are a lot of them. So I mentioned a number of examples. There's probably easily a dozen more detailed examples where you could think about. You log into your patient accounting system right now while we're talking. What work queue has the most accounts in it out of your whole organization? Where is the biggest bottleneck? Probably something you can automate, right? So think about it that way as you approach this. So just to kind of circle back, Jeff mentioned Medua is launched on this journey. We do offer this as a solution set. I've lived in this industry long enough. I still think you should talk to other vendors, talk to everybody, ask lots of questions, and get comfortable with whoever you partner with. If you're interested in partnering with us, that's great. We'll be happy to talk to you. If you have another partner, that's also great. The whole idea here is let's move this industry forward, and let's get this huge administrative cost out of the process, so that more money goes back into clinical care, more patient satisfaction, and everything is great. So with that, I will close it up and we can go to questions.
All right. Jason, Jeff, thank you so much. Very enlightening presentation. Thank you for that.